When can you lift weights after an injury? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I help you feel and perform your best regardless of age or injuries. All right, lifting weights is what so many of us like to do for exercise. I know I'm that way. But after you suffer an injury, that can be really hard. When I was in college, I broke my ankle and was in a cast for 6 weeks and was non-weight bearing for 3 of those weeks. But I didn't miss a day of lifting weights. I got on my crutches and basically went with crutches, sort of hopping, not putting any weight on that leg, going from station to station. I wasn't about to miss it. Now, there's some sort of general guidelines and then some individual things you want to think about. And as I always say, talk to your doctor about specific recommendations regarding weights or exercise after your particular injury. But generally, I think lifting weights can be fine. You're just probably going to have to modify what you do based on what the injury is. So if it's a shoulder injury, you're probably not going to be doing chest and shoulder exercises that potentially make the injury worse. But if it's a lower body injury, then any upper body exercise ought to be fine. But it can be more subtle than that too. Maybe it's just a shoulder pain, but there's no structural damage and you're just trying to recover from it. Well, it may not be eliminating all shoulder injuries. You might have to do a little trial and error to see what exercise actually bothers you. For instance, it may be that doing military press causes that shoulder pain that's giving you trouble, but maybe you doing forward raises, lateral raises, that doesn't bother you so bad. And I know that from personal experience. When I was dealing with shoulder pain about 18 months ago, in addition to some using a lacrosse ball to sort of do some myofascial release and things like that, that was one of the things I changed. I modified certain activities or didn't do certain activities, military press and incline press especially, but I did do lateral raises, forward raises, and some other things that didn't bother me so bad. So that can be really important. The same thing kind of goes with lower body injuries like ankle or knee. You're probably going to be have trouble doing lower body exercises, or you may have to modify a little bit. Now, if you're going through a surgery, this is extremely important to talk to your doctor because you want to make sure that whatever the exercise is not potentially doing harm. So, for instance, if you're doing like a labral repair, a slap repair, the cartilage bumper along the socket of your shoulder, you're probably not going to be able to do biceps, even though it's not really a shoulder exercise per se, but that biceps muscle has a tendon that attaches to the top of the labrum and actually pulls on the repair. So in that case, and really with all of this, very important to talk to your doctor about your specific situation and make sure that yes, while you want to exercise and do things to get in the best shape you can, you want to make sure you don't set your injury back, potentially making it take longer to get better. If you have thoughts about exercise after an injury, after a surgery, specifically weightlifting, leave those in the comments below. Click the video below for much more helpful information. Make sure to subscribe for tons of great videos on all kinds of health and wellness topics, and I look forward to seeing you next time.